Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering pharmacology. We're going to be going over the drugs that you need to know for NCLEX. Now, on this Kahoot, the options that, well, most of the options that I give you, even if they're not the correct answer for the Kahoot, they're still drugs that you need to know for NCLEX. I just didn't make a slide out of them, but they are still drugs that you need to know for NCLEX. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part 1 and part 2. You can sign up for private tutoring session with me, a consultation session. Maybe you want to pick my brain about something. You can have access to audio lessons. If you're really struggling in the program and you really have to do well on your next exam, check my audio lesson, see if I have one that matches the content on your next exam. Very, very soon, my Nexus nursing test bank is rolling out for LPN, LVN, RN, and nurse practitioner students. So watch out for that. Again, my website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle's the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Pharmacology. First question. Okay, what is the therapeutic class of alteplase? Is it a lipid-lowering agent? Is it a thrombolytic agent? Is it an NSAID, or is it an opioid analgesic? Yep, I'm recording. Thank you. I didn't forget. What is a therapeutic class of alteplase? You guys need to know this. Very good. Thrombolytic agent. Break down that word. First of all, anything when it ends in itic, you know it means to break down. Thrombolytic. Thrombo, clot. Itic, break down. What does it do? It breaks down clots, right? It's a thrombolytic agent. That is what this drug does. And you need to know the action. So it converts plasminogen to plasmin. And so what that does is it degrades that part of the clot that's known as fibrin. That's how it does it, okay? Now, with that being said, you also need to know when you would not administer this drug, even if the healthcare provider were to order this drug. What would you notice in the client's chart and patient diagnosis? What would you see that would make you say, I'm not losing my license. You cannot give this if the patient has active bleeding. Because think about what I just said. It dissolves clots, so it puts the patient at risk for bleeding. Do you think that would be a good idea for a patient who's already having an active bleed that's hemorrhaging for you to give this drug to them? Absolutely not. Who else? A type of patients, for example, who have intracranial pressure or just had surgery. Why? I want you to think about it. Whenever a patient has surgery, our top 3 concerns, always, every single time, is developing like a DVT, hemorrhage, infection, and there's another one. What are we concerned about? Them bleeding out. So let me be more specific, because I shouldn't say surgery period, because when you have surgery, you're at risk for clots as well. But there's certain surgeries where the patient's more at risk for bleeding. They're not going to get this, because if the patient had an invasive procedure, that makes them at risk for bleeding, right? All it takes is just one vessel not being cauterized and boom, patient's bleeding. So you have to be very careful when it comes to those type of patients of administering this medication. Absolutely. Thank you. Hemophilia, that's another condition. If your patient has hemophilia, they're already at risk for bleeding. Why would you give this to them? No, we're trying to keep our license. Now, the other options, NCLEX asks about them, so you have to know them as well. You need to know those lipid-lowering agents. You need to know the NSAIDs, and you absolutely need to know opioid analgesics. All right, true or false? The action of benztropine is to exhibit anticholinergic properties in the central nervous system. Is this true or is this false? Again, the action of benztropine, I can't speak. Benztropine is to exhibit anticholinergic properties in the central nervous system. Is this true or is this false? It's true. It's true. This drug, guys, a couple things you have to know about this drug. You have to know that it's an anticholinergic agent. Don't forget what I taught you about the anticholinergics. You're going to watch out for the poem. Can't see, can't spit, can't pee, can't see, decreased vision, blurred vision. Can't spit, xerostomia, dry mouth. Can't pee, urinary retention. Can't, constipation. Can't see, can't spit, can't pee, can't. All right, you're going to be watching out for those. When it comes to this drug, guys, it treats Parkinson's disease. Uh, guys, I don't do co-hosts on the Kahoot. It treats Parkinson's disease. Specifically, you need to know that it decreases rigidity and tremors. That's a question. You need to know that. When you're giving this drug, you have to watch out for adverse effects that I just mentioned, but some I didn't mention are as like arrhythmia, cardiac arrhythmias, a decreased blood pressure, palpitations. Okay. Make sure you know this drug well. Make sure you know your nursing interventions. Make sure you know the adverse effects. How are you guys doing on the live? Okay, let's go. Select all that applies. What are important nursing considerations for calcium acetate? Select all that apply. Here are your options. May cause cardiac arrest, may cause cardiac arrhythmias, may cause hypotension, may increase the risk for digoxin toxicity, must be administered slowly, may cause phlebitis at the insertion site. What do you guys think? We're talking about calcium acetate. What are important nursing considerations to know in regards to this drug? Ken Barbie, thank you for sharing this live. Thank you. Kale's just passed NCLEX. Congratulations. Select all that apply. All of them. Who would have thought? Calcium, right? Calcium acetate. Mm-hmm. Calcium acetate, guys, this is a mineral electrolyte supplement replacement. Okay. Now, this is needed for neuromuscular, it's needed for the skeletal system, but there are some serious adverse effects. Look at these adverse effects. You need to know that for NCLEX, okay? Usually when NCLEX asks about this drug, it is in select all that apply format. So make sure you guys know all of these adverse effects, okay? In addition to this, there are a couple other things that NCLEX asks about that I just didn't have enough options to put on there. So I'm going to tell you what they are. One of them is vitamin D. You got to teach the patient about foods high in vitamin D because remember, vitamin D is needed for calcium to be absorbed. What's the point of having calcium if you can't absorb it? So you're going to teach the patients foods high in vitamin D. So you need to know what foods and drinks are high in vitamin D, and you have to teach the patient that they have to stay hydrated. This type of patient that's taking this type of drug cannot be dehydrated. We need to keep them hydrated. You're going to teach them to drink lots of fluids. Okay. Rebecca, thank you for sharing the live. Which drug is a cardiac glycoside and treats CHF, AFib, and A-flutter? So I gave you two hints. I told you it's a cardiac glycoside, and I told you the conditions it's known to treat the most. Here are your choices. Aspirin, buspirone, cortisone, or digoxin. What drug are we talking about? It's a cardiac glycoside, and it's known to treat congestive heart failure, atrial fibrillation, atrial flutter. Aspirin, buspirone, cortisone, or digoxin. Very good. Digoxin, you need to know digoxin well. You need to know The action of digoxin increases the contractility of the heart. You need to know adverse effects such as bradycardia. You need to know, what else do you have to know about that? Oh, you got to know the symptoms of dish toxicity. You got to know therapeutic range for digoxin. You got to know what drugs digoxin interacts with. Make sure you go back and study digoxin. NCLEX asks about it a lot. NCLEX also asks about these other options. Aspirin, which is a salicylate, you need to know that. Buspirone, which is an anti-anxiety drug. And of course, cortisone, which is a corticosteroid. You need to know those drugs for NCLEX. The code to get in is 295-0890. 295-0890. Guys, if you can type that on the live for me for the latecomers, please. Thank you. Back to digoxin, a couple other things you need to know for all drugs. We have to make sure the patient's kidney function is working properly, but especially digoxin is one of them. You're going to be checking the kidney function. Make sure you're looking at the urine output. Make sure you're looking at the BUN and creatinine. You need to know that when this patient's on digoxin, you better be checking that patient's potassium level, okay? Decreased potassium. You know how potassium is supposed to be 3.5 to 5? If that patient is hypokalemic, that potassium level is lower than 3.5, that can cause the patient to have dish toxicity. While the patient's on digoxin, you also need to be looking at the patient's calcium levels. Okay. If that patient's hypercalcemic, that also can cause the patient to have dish toxicity. Make sure you guys know this. All right, we're halfway there. Which drug is an ACE inhibitor? Enalapril, metoprolol, verapamil, or losartan? From what's been reported to me, my students who've taken NCLEX, they come back, they tell me that the NCLEX asks about the drug classes for the antihypertensive agents. So not only do you have to know this drug class, you have to know the other drug classes that I have listed as well. Okay. Very good. Enalapril, that's an ACE inhibitor. If you've been following me for any amount of time, I've told the story a million times. April was my arch nemesis in the nursing program. She and I would always fight for first place on exams. And so I always remembered that April always aced her exams. ACE inhibitor, those drugs that end in pril, those are your ACE inhibitors. You need to know this. What about metoprolol? What drug class is that? Metoprolol. Quickly, guys. Really? Thank you. Beta blockers. Verapamil, calcium channel blocker, and losartan. That's another antihypertensive agent that comes from the sartan family. So you guys have to know the different drug classes, okay? Yep, ARB. Very good. There's something else you got to know about the ACE inhibitors. Wait, I'm not going to change screens yet. What else does NCLEX ask about ACE inhibitors? Oh, when when it comes to the ACE inhibitors, one of the things you have to watch out for, you have to teach a patient actually that it may cause a productive cough, especially a non-productive cough in patients that are Black. So you teach them, if you just start to develop a cough, let us know immediately. Why? There's so many drugs on the market. If this drug is causing that annoying cough, why sit there and suffer or be non-compliant because you just decided to stop taking your drugs, your meds, because you don't want to cough when there's so many other drugs that can be given. So you need to know about that dry cough. It's non-productive. Okay. You need to know about the dry cough. You need to know that patients who are on ACE inhibitors, you better be checking their WBCs. And the reason for that, this drug can cause neutropenia. Okay, we're going to be concerned about that patient being at risk for infection. So you better be looking at their levels for WBCs. Okay. True or false? Fentanyl is an over-the-counter drug. Is this true or is this false? You guys are killing me. The code to get in is 295-0890. 295 0890. True or false? Fentanyl is an over-the-counter drug. True or false? Very good. False. False, 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 false. This is an opioid agonist, okay? Um, it is very, 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 very controlled because it's a very strong, very potent drug. This drug, what else do you need to know about this? If you give it, you better be watching the respirations because it can decrease the patient's respirations. Excuse me, you better be watching the patient's blood pressure. This drug cannot be taken with MAOIs. If a patient's on an MAOI, they can't take this drug, okay? So contraindication would be MAOIs, grapefruit juice, they can't have that either. You're going to be watching out for low respirations, low blood pressure, and laryngospasm. That is an emergency because obviously, if you can't breathe, we don't care about anything else, right? So you're going to be watching out for those. True or false? Glipizide is a type of insulin. Is this true or is this false? Glipizide. Oh my goodness. Oh my gosh. I'm very shocked that about half of you guys were on the other team. No, let's talk about this because NCLEX expects you to know this. There should be no confusion about this, guys. Glipizide is an anti-hyperglycemic agent, but it's not insulin. So insulin is an anti-hyperglycemic agent. Glipizide is an anti-hyperglycemic agent, but they're not the same thing. Insulin is administered either by injection subcutaneously or by IV, where glipizide is given by mouth. Insulin cannot be given by mouth. The minute the patient takes that thing by mouth, those the hydrochloric acid in their stomach just tears the drug apart. The drug will not be effective. Insulin cannot be taken by mouth. It can be given by injection, sub-Q, or IV, where glipizide is given orally. Glipizide is not a type of insulin. They both bring down the blood sugar, but it's not a type of insulin. You need to know this. On top of that, what else do you guys need to know about glipizide? Glipizide, guys, like I said, oral. You need to know it's by mouth. It's an oral anti-hyperglycemic agent, anti-diabetic agent, and it comes from the sulfonylurea family. Professor D, do I need to know this? Absolutely. And here's why. You need to know the action of sulfonylurea. That's actually another test question, guys. The action of sulfonylurea, I'm not going to explain it in the technical professional term. I'm not going to do it that way. I'm just going to explain to you what the heck it does, okay? So sulfonylurea walks up to the pancreas and says, hey, wake up, wake up, wake up. And the pancreas wakes up and shoots out insulin, right? Endogenous insulin, the insulin that the pancreas naturally makes. Now, this is the important part that you need to know. Glipizide acts on the beta cells in the islets of Langerhans of the pancreas. You need to know that part. So not only the pancreas, you need to know specifically where the beta cells and the islets of Langerhans. Why is that important to us? Well, remember how I told you glipizide is only given orally? Remember how I told you glipizide will literally walk up to the pancreas, knock on the door, say, hey, beta cells and islets of Langerhans, wake up. And it'll wake up and shoot out more insulin. Well, what if that patient's a type 1 diabetic? That patient will be 6 feet under, long gone before this medication ever takes effect. Why? Because their pancreas is non-functional. So this is a big thing when it comes to any drug that is a sulfonylurea. Their pancreas has to be functioning properly. So you would never give this drug to a type 1 diabetic or any patient that has a condition where their pancreas is not functioning. That's important to, like, literally, guys, in the last 3 minutes, I gave you 5 NCLEX questions. You need to know this. Don't say I didn't warn you. All right. You guys with me? Okay, let's keep going. True or false? Hydralazine is the first line treatment for hypertension. Is this true or is this false? Hydralazine, is this the first line treatment for hypertension? Well, you guys are answering this one real quick. Is this a first line drug for hypertension? First line means the first thing that you're going to do, the first thing that you're going to go to. False. False. Hydralazine is very, very, very strong. It's very, very, very potent. By the way, hydralazine, it's an antihypertensive drug. It's very, very potent, and it's got some serious adverse effects. So this is not the first, even the second or third line treatment for hypertension. We really go to hydralazine when nothing else seems to be working to get this patient's blood pressure down. So it's not the first line treatment. You need to know those adverse effects for hydralazine. Well, it depends. It depends on your race. It depends on if you're a diabetic. It depends on if you have kidney issues. What the first line treatment is. It depends. As I was saying, sorry guys. Adverse effects, very serious. It can cause the patient to have cardiac arrhythmias. It can cause them to have angina. With this type of drug, again, you cannot give this drug if the patient is on an MAOI or they've been on an MAOI for the past 2 weeks. Most drugs under the sun are contraindicated with MAOI, so you got to make sure, even if the patient stopped that MAOI, you got to make sure they've been off the MAOI for a couple of weeks before they can start this drug, okay? You're going to be watching out. Remember, I told you this drug is very, very, very strong. It's very, very, very potent. You're going to be watching out for hypotensive crisis. You're going to be watching out for orthostatic hypotension. You're going to dangle that patient. You're going to teach them to press the call button if they need to get up for any reason, because safety is going to be a big issue when it comes to this drug. All right, type in your answer. Iodine inhibits the release of blank hormone. What is it? Type in your answer, guys. Iodine inhibits the release of blank hormones. Type in your answer. Let's see what you said. Aldosterone, I don't know. ADH, exocrine. It's thyroid. Thyroid. Iodine inhibits the release of thyroid hormones. Hold on. I want to see what else you guys had on here. T3, T4, serotonin. Dopamine, iron. Okay. So yeah, iodine inhibits the release of thyroid hormone. So you guys need to know that this is an anti-thyroid agent. And so it's given often as like a pre-treatment to thyroidectomy if the patient has to get that thyroid gland removed. Also treats that patient that's in thyrotoxic crisis and for radiation exposure. Okay. How many questions do we have? This is the 9th slide, and there's 10 total. So there's one more, and then we're done. How do I move on to the next slide? Submit? Cancel? Okay. All right, last question. What is the last question? This fluoroquinolone, also known as Levaquin, is used to treat UTIs, gonorrhea, bronchitis, pneumonia, skin infection, bone infections, and more. What drug are we talking about? Is it levofloxacin? Is it Levacor? Is it Levaquam? Or is it levaquinolia? By the way, you need to know, actually, if you're an NP student, not LPN or RN, but if you're a nurse practitioner student, you need to know what conditions fluoroquinolone is expected to treat. FYI. By the way, guys, my Nexus Nursing Test Bank that's coming out soon, the test bank is for LPN, LVN, RN, and nurse practitioner students. I have lots of questions for you guys as well, okay? All right, the correct answer, very good. 106 of you guys went with levofloxacin. I made up the other drugs. The other drugs don't even exist. I just made them up. Levofloxacin, that's your fluoroquinolone. You need you're not expected, you're not the one who's going to be prescribing those drugs, but you do need to know what conditions you'd expect the healthcare provider to order, okay? You need to know that fluoroquinolone, the trade name is levofloxacin. You see levofloxacin, what do we talk about? Fluoroquinolone. Fluoroquinolone. um, Alexa says, I had a feeling those others weren't real. LMAO. So here's a testing tip. Let me tell you something. If you get to NCLEX, you see a question and you're looking at your answers and you have no idea what the answer is, like you have no clue. Stay away from the answer choice that you've never seen before in your life. Because what happens is most students say, whoa, I've never seen this. This must be the answer. Maybe I was taking a nap while the instructor was lecturing. No. Remember, NCLEX is testing you to see if you're prepared to be an entry-level nurse. So most likely your answer is going to be something you've seen before, something you've heard of before. Even if you don't know what the answer is, choose something that looks familiar to you instead of something that looks unfamiliar, okay? All right, let's see how you guys did.